So I think that if you're predisposed to, let's say, anxiety attacks, panic attacks, or stress, or depression, or even bipolar, with just as a normal challenge that you're going through, be it man or woman, now you add your periods on top of that, it escalates it to another level.
90% of menstruators experience at least one of the symptoms of PMS, with the most common ones being bloating, headaches, or moodiness. But for some women, the symptoms usually go beyond the minor discomfort and the feeling of being off. About 3 to 8% of menstruating women suffer from premenstrual dysphoric disorder, commonly known as PMDD, a severe, often disabling extension of PMS. While often viewed as a primarily physical experience, menstrual-related mood disorders prove that your periods each month can have an impact on your mental health. Today, we are joined by trained psychologist Reson from Resilience Counseling Center as we look at the myths, misconceptions, truths, and the realities of the relationship between mental health and your menstrual cycle. Welcome, Reson.
Thanks so much for having me.
Yeah, so we'll just start off with what are some of the psychological effects caused by hormonal changes during the menstrual cycle?
All right, I think I can begin by saying that PMS will definitely come with its own challenges in regards to our mental health. And first of all, we also need to understand exactly what mental health is. Mental health is our thoughts, our feelings, and our emotions. Anything that interferes with those three aspects or affects of us as individual will definitely affect our mental health. So if our thoughts are affected, our feelings and our emotions, these three aspects determine how we will behave. So during our menstrual cycle as women, we go through hormonal imbalances which cause us some issues and affects us probably in terms of our thoughts, our feelings, and our emotions again. And by this I mean we can become very stressed because of the pain of the cramps and the destabilizations of our moods. We can become very anxious because we are wondering, okay, I'm on my periods, let's say I'm entering a mat. Am I going to stain my dress or my whatever it is? Or you might be wondering, okay, I have my periods. Do I have enough money to buy the pads that I need for the whole duration of the periods? So we can go through moodiness. We'll be moody because we don't understand what is happening. With the imbalances of the hormones within us, we can go through that anxiety and also feel very stressed, which will increase the pain that comes with the cramps during periods.
So does the state of my mental health affect my menstrual cycle? And if yes, how might some behaviors affect it?
Having your period every month, for most women, the mental health will also be affected. And this comes with the normal signs and symptoms of PMS, which are, anxiety, stress, fatigue, lethargy, feeling moody. And also, the other things, the physical symptoms of, breast tenderness, you feel, some people feel like they're nauseated most of the time. They change their eating patterns and habits, and even sleeping can also be affected. So I think that if you're predisposed to, let's say, anxiety attacks, panic attacks, or stress, or depression, or even bipolar, with just as a normal challenge that you're going through, be it man or woman.
Yeah.
Now you add your periods on top of that, it escalates it to another level.
Yeah.
So your moodiness is now like 0. Normally it's maybe 5, it goes to about maybe 50.
Yeah.
The bipolar can really be triggered to a totally different level. Depression can now be so overwhelming that you cannot really function in a normal way. And in a normal way, I mean that your social life is affected, your professional life is affected. If you're a student, you know, going to class, being able to sit down and concentrate is also affected. So yes, having your period really does affect your mental health. Just considering the predisposition that you have with other mental health disorders. Yeah.
So we talked about PMS and PMDD and how there are some of the menstrual related mood disorders, but what are some of the symptoms that distinguish between the two? Like, when do you know, okay, PMS, this is normal, but now what symptoms escalate it to become now PMDD?
Okay. First of all, it's important to know the difference between PMS and PMDD. For PMS, yes, you have anxiety, you have stress, you have moodiness, you have social rejection, you withdraw yourself from, you know, your friends, your normal daily activities of life. And the moodiness, the physical challenges, you know, we've talked about the tenderness of the breast, the nausea, the fatigue, the lethargy. Now, with PMDD, it's actually the same completely. The only difference is it's on another level. With PMS, it really doesn't affect. You can cope. You can cope with going to school, cope with going to work, cope with meeting your friends for a drink or socializing. But with PMDD, you are completely incapacitated. You can't function the way you normally do. You resign yourself to whatever is happening to you, physically, emotionally, and psychologically. So that's the difference. And just to add that PMS or PMDD has been recently classified as a mental health issue, which is also in the DMS, which is the manual that doctors, psychiatrists, and psychologists refer to really get what condition a patient or client is going through. So if you have if you go to let's say a client comes to me, and they say, Reson, I've been feeling really tired, I'm so moody, I've become so withdrawn, I don't really socialize with my friends the way I used to. If she mentions maybe 4 out of what is in the DMS, then I will be able to classify this client as having PMDD as opposed to just PMS. Yes, exactly.
Okay.
The difference between PMS and PMDD, another really major difference is that, yes, in PMS you will get depressed or moods or highs and lows,
period blues.
But with PMDD, it normally goes to especially if you've been predisposed to bipolar, it can get to frequent suicidal thoughts. So you can imagine every month going during that time, going through suicidal thoughts every month. So that's something that really is you can differentiate between the two
of them. So what are some of the ways that I can use to help me cope with PMS and PMDD?
I think one of the most important ways is, first of all, to identify exactly what it is you're feeling, what it is you're thinking, what are your emotions, what are they, how are they affecting you, what are the triggers? Because in everyday normal life, we all have mental health challenges. A friend can stress us, a relationship can bring us down, a child can be troublesome to the level where they affect our moods or emotions. So when you bring in PMS or PMDD, when you are aware of what you normally go through as an individual, because everybody's journey is very subjective. It's very individual. So if I'm aware that every month I'm very, very moody because my periods, a week before my periods comes, I know, don't even come near me. Don't joke with me. Today we are not friends. Today I'm eating all the samosas. Nobody touch my food the way people go to the fridge and touch my food.
And pinch.
Yes, and finish. So when I know that everything is heightened to another level, I will be able to control or to be aware that, okay, I know that I have been a bit more moody than usual, but I know it's because of the PMS or PMDD. So being aware, just be self-aware.
Yeah.
Because when you're self-aware, then you will become self-acceptance of the situation and the condition. Okay. The other thing that one can do is just eat a balanced diet. If you probably talk to a nutritionist or somebody who can inform you or advise you on what to eat, what to drink, what can help with the cramps, with the moods and everything, that would also help.
Yeah.
Another one that I have found to be very, very effective, especially for my clients, is journaling. Come up with a log, a mental health log, where you log in. Today I woke up feeling rather low. I don't understand why I'm feeling rather low. Then you're able to relate, oh wait, my periods are coming next week.
Yeah.
So now I understand why I'm feeling the way I'm feeling. If you're able to have a log of your thoughts, your emotions and your feelings, it will also help you own the process and be aware of exactly what is going on. And the final one probably I can say is exercise, you know, running, walking, jogging, gymming, anything to keep you active. Yeah.
Helps. Because when you're also working out, then you release, is it oxytocin?
Yes, oxytocin.
Like, positive hormones.
And all those
so you're helping
hormones
to balance, because especially during your period, those hormones are usually really low.
Exactly.
So then now when you're working out and you're releasing them, then like now you've sort of found a way to balance your hormones. Naturally.
Exactly.
What can be misdiagnosed as PMDD or as PMS?
I think I will take that as a psychologist, because if a client comes to me and they're going through, probably they have depression, they have anxiety attack or panic, and probably even to the level of bipolar.
Yeah.
I will need to really look at the client's history. And by history, I mean when a client comes to me, they'll come with the presenting issues. Yeah. Probably they come and say, I'm so stressed at work. Okay, what's stressing you? My boss. Okay, how can we, how do we identify skills and tools to help you cope with work? Because you're not going to resign because of your boss, at least if it hasn't gotten to that level. So once we go through the presenting issues, then we are able to go down slowly as the client opens up and shares. I will be able to identify the underlying issues. Once the underlying issues have come out, and for example, an underlying issue in this can be that I am stressed because I am not meeting my targets of what I'm supposed to be meeting. And why am I meeting those targets? Because I am not applying myself fully to work. So the problem is really not the boss. The problem is you, because we have identified the underlying issues. Now, to differentiate between PMS and PMDD and probably mental health issues is to, with the log journal that I've just said, if you have one, you're able to go back and identify that this happens at this time, and this happens at this time. But if it happens all the time, then you know it is not PMS or PMDD.
Okay, so journaling is important. And write the dates. And then also now track it with your cycle. Are other mental health issues among women, so for example postpartum depression or depressive symptoms during the menopause transition, similar to PMS or PMDD?
I think they definitely are, because they all have to do, again, with our thoughts, our emotions, and our feelings. And as long as these three aspects of ourselves are in any way brought into some sort of destabilization, it's going to affect us one way or another, with or without the periods.
Yeah.
But you, as an individual, again, it is for me to identify why, when it is happening, how often, and why it is happening. Of course, with the PMS and PMDD, chances of infertility, chances of other women reproductive issues or challenges will definitely come up.
Yeah.
And if as a woman I have been diagnosed as being infertile because of my PMS or my PMDD, of course it's going to affect my mental health. I will feel a certain way. I will feel inferior to other women. I will feel that I am not complete. I will feel that I've let down my husband. I will go through some self-blame, some self-shame, and also get to a point whereby, it can also get to the point of helplessness, hopelessness, which eventually leads to suicidal ideation or suicidal thoughts. Yeah.
Ah, okay.
Yeah.
So when would I know that it's time to see a specialist?
Now, anything that interferes with your activities of daily living, that incapacitates you in a way that you are not functioning to your best of your capabilities, is a red sign in any situation. Because this means I'm not able to get up and go to the bathroom. I'm not able to brush my teeth. I'm not able to comb my hair. I'm not able to report to work. Probably I know I'm supposed to be at work at 8. I can't make it, or I couldn't be bothered. It even gets to the point where, too bad. I can't do it, and I don't feel like doing it. And actually, I don't have to do it. When you start having that sort of conversation, and mentality, then you know that it's time to seek help. And sometimes seeking help is also identifying who is your support system. Who do you have around you? Am I able to share this with a friend, with my mother, with my lady group, or who is there for me to feel vulnerable enough to say that I am not doing well. I am not, I am at a very vulnerable place, and I am not coping well. So at that particular moment, it is good to reach out to somebody that you have identified that will be able to take you now to the next level. And also you will feel that you're not alone.
Thank you so much for joining us to answer our questions. And even we've just unpacked PMS and PMDD, but mental health is a broad topic, and there are also other disorders that Reson might have mentioned, like anxiety, panic attacks, bipolar, depression. So I think even as we talk about the relationship between periods and your mental health, it's important to also just prioritize your mental health at all times, whether you're female, whether you're male. And I think we don't have these conversations enough of putting ourselves first, and even self-love, showing that, taking care of yourself and taking care of your mental health. So definitely, even if you don't suffer from PMS or PMDD, then definitely the ways that you shared with us, so exercise, journaling, having a support system do help you, cope with different, because in life, like we were talking with Reson, especially as a woman, you're always morphing and you're always growing and you're always evolving. And the stages that you're going to are challenging because you've never been there before, so you'll definitely be anxious. So definitely put your mental health first, and maybe Reson can share with us where people can find you in case they would like to, see a therapist.
Okay. I think before I share where you can find me if you need any psychological help or therapy, I just want to put it out there that it's also important for our partners, maybe our husbands, our boyfriends, our sons, the men in the society, to also be a bit more sensitive to the women in their lives, to their daughters, to their mothers, to whoever whichever woman is in your life at whatever moment, to know that they could be going through, yes, and they could be going, they might be on their periods, like we are, people will throw it around. Wachana nae kona PMS, we are kona periods, Yes, akonai, but be more sensitive, because this is something that somebody cannot help.
Yeah.
You are trying so much to deal with it as it is. You really don't need the other stigma or judgment that will come from, external factors.
Yeah.
So let us just be more sensitive in regards to PMS, PMDD, and mental health.
Yeah.
Should you require any help in regards to issues to do with mental health, my practice is called Resilience Psychology Counseling Practice, and I'm located in Karen, Kofisi Karen, which is opposite Waterfront Mall and on Karen Road. We are open from 9 to 5 p.m. Monday to Friday. So karibu. Yeah.
Thank you so much, Reson, for joining us. So that's it from us for today for this episode, and do be sure to stay tuned for the next one. Thank you and bye.
Bye.